X-ray, which are showed with miliary TBs, mostly Mycobacterium intercellular from the avian family. Is it clear? So those are the different things that you have to understand. So after visualizing those opacities, you need to know that on the long fields again, you can see the hypertrophies of the veins, the arteries. Is it clear? So you can see hypertrophied arteries. Is it clear? And when you see hypertrophied arteries, you can think of pulmonary hypertension. Another element that can help you to know the pulmonary hypertension is that normally when you have the aortic arc, the arc of the aorta on the X-ray is having three components. It has the first component, it has the second component, and it has the third component. If you visualize very well on normal X-ray, you're going to see the arc of aorta having three components. The arc, the cardiac arc having three components. It has the first component, second component, third component. The first cardiac arc shows the arc of the aorta, meaning that the arc of the aorta is turning. The second cardiac arc shows the pulmonary trunk. And the third cardiac arc shows the left ventricle. Now you need to know that in a case where a patient is having a pulmonary hypertension, this pulmonary trunk is going to get straightened. When you have pulmonary hypertension, it is going to be straightened. Since it is straightened, you're going to have something like this. You have the first pulmonary arc. Now, when we are going to the second, it is straightened. Since it's straightened, you're going to have now a tip like this, and then you have the third pulmonary arc. So when you are going to have this tip like this, shows that it's as if there is a loss of that second cardiac arc. Is it clear? So when you have a patient that has a loss of the second cardiac arc, it can also be another sign of pulmonary hypertension on the X-ray. So those are the things that you need to visualize on X-ray. You have also pulmonary oligemia. Oligemia. Pulmonary oligemia can also be visualized in a case where you have when you have a tetralogy of Fallot. And in tetralogy of Fallot, you need to know that you are going to have pulmonary, or you have also pulmonary stenosis. Where there is reduced blood supply to the pulmonary circulation, you are going to have pulmonary oligemia, meaning that the pulmonary vessels are not going to be seen, despite a very good exposure. Those are the different things. This is a very good exposure and the penetration of the X-ray. So those are the different things that you can visualize. Another thing that you can visualize also, you have the cotton wool appearance. Cotton wool appearance is a peculiar sign that we have in a case of pulmonary edema. And you need to know that we have specific signs of pulmonary edema on the X-ray. That I'm just going to tell you. So pulmonary edema is going to also have specific sign on the X-ray, and the signs of the pulmonary edema are also associated with the mnemonics A, B, C, D, E. A for the alveolar opacity. So when you have alveolar opacity, you think of pulmonary edema. Pulmonary edema is associated with alveolar opacity, and alveolar opacity is shown as cotton wool appearance. And that cotton wool appearance resembles a ground glass pattern. It's as if they are grounded glass. That's cotton wool appearance. Now B is going to be for the bat wing sign. You are going to have B is going to show you the bat wing sign, and that bat wing sign is also another sign of bat wing sign is also another sign for pulmonary edema. So B is like a bat wing sign, meaning that on the X-ray, so let's say that you have the X-ray like this. At the medial aspect, you see something like the bat wing sign, the wing of a bat like this. So that bat wing sign is also another sign for the bat wing sign is also another sign for the pulmonary edema. Now after the bat wing sign, the next sign that you can visualize still at B are the curly B lines. Now for the SchrDbb lines, when you have straight lines like that, straight reticular opacity line located at the base of the lung fields, it can tell you that it's also pulmonary edema. SchrDbb lines is SchrDbb lines. Now after the SchrDbb lines are just one example of linear reticular opacities. After the SchrDbb lines, you have the C Richter, whether it's cardiomegaly. But you need to know that cardiomegaly occurs when you have a cardiogenic, because you have two types of pulmonary edema. Pulmonary edema has two types. You are going to have a cardiogenic, which is a sort of cardiogenic origin, and you have a non-cardiogenic from other origin of pulmonary edema. So when you have cardiogenic, you're going to visualize cardiomegaly in pulmonary edema, and we are yet to still explain cardiomegaly when we're going to visualize C of the X-ray. Now the next one is D D of the pulmonary edema. D on pulmonary edema shows just redistribution of blood vessels, redistributions of blood vessels. And the redistribution of blood vessels means that normally you have blood vessels which are going to be located more down than up. But in the case of pulmonary edema, you have blood vessels located more up than down. It is also called the cephalization of blood vessels. So those are the different things that you have to understand when you want to know pulmonary edema. So those are the things that you want to understand when you want to know pulmonary edema. And all is when you are seeing still the lung field in B, that is breathing. So now you need to know that the pulmonary edema, as we said, is divided into cardiogenic and non-cardiogenic. For non-cardiogenic pulmonary edema, you're going to have the A, that's alveolar opacity. You're going to have the B, that's the SchrDbb line. But you need to know that generally in non-cardiogenic, the lesions are more peripheral than central. In non-cardiogenic, the lesions are more peripheral to the lung field than central. While in cardiogenic pulmonary edema, the lesions are more central than peripheral. And since there is congestion of the blood vessels, that's why you are going to have cephalization of the vessels. And there is cephalization of the vessels. Why? Since there is congestion, we are going to see more of the pulmonary veins. Since there is congestion, you're going to see more of the pulmonary veins than the arteries. And the veins now are going to be located more at the apical aspect than the arteries, which are located more at the base aspect. The veins are located more at the apical aspect than the base aspect where the arteries are located. So that's why you're going to see more the apical aspect than the base. That's why it's called a cephalization of the blood vessels. Those are the different things that you have to understand. And so this one is particular, or the redistribution of blood vessels is particular to pulmonary to cardiogenic pulmonary edema. Now, E aspect of the pulmonary edema is when you have a pleural effusion. Effusion now can also be associated with edema, and we are going to see it still on the X-ray as we are going to continue with the terminology. So here we have visualized now the breathing, or the B aspect, when you are visualizing pathologic sign on the frontal view or the posterior anterior view of the chest X-ray.